For decades, we've been told that the key to healthy aging is getting more medical tests, more screenings, and more monitoring. But what if I told you that after age 70, some of the most commonly ordered medical tests are not only unnecessary, but could actually be harming your health and peace of mind? I'm here today to share some uncomfortable truths about 5 medical tests that, frankly, you should question after turning 70. The medical establishment has created a culture of fear around aging, convincing us that we need constant surveillance to catch problems early. While this approach might make sense for younger adults, the reality for those over 70 is drastically different. Your body has already proven its resilience by reaching this remarkable milestone, yet doctors continue applying the same testing protocols designed for 40-year-olds to 75-year-olds, and this one-size-fits-all approach is deeply flawed. What troubles me most is how these unnecessary tests create anxiety, lead to overtreatment, and sometimes cause more harm than the conditions they're supposed to detect. Many of my colleagues won't discuss this openly because it challenges the current medical paradigm, but I believe you deserve to know the truth about what's actually beneficial for your health versus what's simply routine medicine. The fundamental problem lies in understanding the difference between lifespan and health span. At 70 and beyond, the focus should shift from aggressive disease detection to maintaining quality of life, functional independence, and comfort. Yet our medical system continues pushing tests that were designed with the assumption that you have decades of life ahead of you, when the reality is that some conditions detected through screening may never actually affect your remaining years. Let me start with one of the most controversial topics in senior healthcare: routine mammograms for women over 75. The medical community has been reluctant to discuss this openly, but the evidence is clear that continuing annual mammograms after age 75 provides minimal benefit while creating significant risks. The sensitivity of mammograms decreases with age due to changes in breast tissue density, leading to more false positives that require additional testing, biopsies, and procedures. Consider this sobering reality. Breast cancer detected in women over 75 often grows so slowly that it may never become life-threatening during their remaining years. The aggressive treatment protocols developed for younger women, including surgery, chemotherapy, and radiation, can be far more harmful to a 78-year-old than the cancer itself. The stress of unnecessary biopsies, the anxiety from false alarms, and the physical toll of treatments often reduce quality of life more than the untreated cancer would. The second test that deserves serious scrutiny is routine colonoscopies for adults over 75. While colorectal cancer screening has proven benefits for younger adults, the risk-to-benefit ratio shifts dramatically after age 75. The preparation for colonoscopy can be particularly dangerous for seniors, causing severe dehydration, electrolyte imbalances, and falls. The procedure itself carries higher risks of complications, including perforation, bleeding, and adverse reactions to sedation. More importantly, colorectal cancer typically develops slowly, often taking 10 to 15 years to progress from initial polyp formation to invasive cancer. For someone who's 76 years old, the likelihood that a newly detected polyp will develop into life-threatening cancer during their remaining years is relatively low. Meanwhile, the physical trauma of the procedure and the cascade of interventions that follow abnormal findings can significantly impact their quality of life. The third unnecessary test is routine bone density scanning for osteoporosis in adults over 80. While osteoporosis is certainly a concern for seniors, the way we screen and treat it has become problematic. Bone density tests often detect osteoporosis in older adults who may never experience fractures, leading to aggressive treatment with medications that carry serious side effects, including increased risk of atypical fractures, jaw necrosis, and esophageal problems. The focus should be on fall prevention rather than bone density numbers. A strong, active 82-year-old with moderate osteoporosis who practices balance exercises and maintains muscle strength is at much lower risk for fractures than a sedentary 75-year-old with normal bone density, yet our medical system continues to treat numbers rather than the whole person, prescribing powerful medications based on test results rather than functional assessment. The fourth problematic test is routine prostate cancer screening with PSA tests in men over 75. The prostate-specific antigen test has led to massive overdiagnosis and overtreatment of prostate cancer in older men. Most prostate cancers detected in men over 75 are slow-growing and would never become life-threatening. However, the anxiety of an elevated PSA often leads to biopsies, further testing, and aggressive treatments that can cause incontinence, erectile dysfunction, and other serious quality-of-life issues. The statistics are sobering. Autopsy studies show that up to 80% of men over 80 have prostate cancer cells, yet most of these men died of completely unrelated causes. This means that prostate cancer is often a condition you die with, not from. The treatments, however, can definitely diminish the quality of your remaining years. The psychological impact of a cancer diagnosis, even when the cancer poses no real threat, can be devastating for seniors and their families. The fifth unnecessary test that concerns me most is routine cardiac stress testing in asymptomatic adults over 75. These tests often detect minor abnormalities that lead to invasive procedures like cardiac catheterization and stent placement, which carry significant risks for older adults. The recovery time from these procedures can be prolonged, and the benefits are often minimal for seniors who aren't experiencing cardiac symptoms. The heart changes naturally with age, and what appears abnormal on testing may simply reflect normal aging processes rather than disease requiring intervention. A 77-year-old who can walk upstairs, garden, and maintain daily activities without chest pain or shortness of breath doesn't need aggressive cardiac testing to prove their heart is healthy enough for their lifestyle. What makes these unnecessary tests particularly harmful is the cascade effect they create. One abnormal result leads to another test, which leads to specialist consultations, which lead to procedures, each step carrying its own risks and potential complications. This cascade often transforms a healthy senior into an anxious patient, moving from doctor to doctor, accumulating diagnoses and medications for conditions that may never have affected their life. The psychological impact cannot be understated. When a 74-year-old receives an abnormal test result, even if it's a false positive, the anxiety and stress can be overwhelming. Sleep becomes disrupted, appetite decreases, and the enjoyment of daily activities diminishes while waiting for follow-up tests or procedures. This stress response can actually trigger real health problems, creating a self-fulfilling prophecy where unnecessary testing leads to genuine health decline. Financial considerations are also important, though rarely discussed openly. These unnecessary tests and their follow-up procedures cost thousands of dollars and contribute to the unsustainable rise in healthcare costs. For seniors on fixed incomes, the copays, deductibles, and out-of-pocket expenses can be financially devastating. Money spent on unnecessary medical testing is money that could be used for activities that actually improve quality of life, like physical therapy, nutritious food, social activities, or home modifications for safety. The overuse of these tests also reflects a fundamental misunderstanding of what constitutes successful aging. True health at 70 and beyond isn't measured by perfect test results, but by functional capacity, social connections, mental clarity, and the ability to engage in meaningful activities. A 73-year-old who tends a garden, plays with grandchildren, and maintains independence despite having some minor abnormalities on medical tests is healthier than a 73-year-old with perfect test results who's too anxious about their health to enjoy life. Instead of routine screening tests, the focus for seniors should be on functional assessments. Can you climb stairs without significant shortness of breath? Can you maintain balance while walking? Are you able to perform activities of daily living independently? Do you have the energy to engage in activities you enjoy? These functional measures are far better predictors of health outcomes than laboratory values or imaging results. The medical community needs to acknowledge that the goals of healthcare change as we age. In younger adults, aggressive screening and early intervention makes sense because there are many years of life to preserve. But for seniors, the primary goals should be maintaining independence, minimizing discomfort, and preserving quality of life. This requires a completely different approach to medical testing and intervention. This doesn't mean abandoning all medical care after age 70. Certain tests and treatments remain valuable for seniors, particularly those that address symptoms or functional problems. If you're experiencing chest pain, investigating the cause makes sense. If you're having difficulty with daily activities due to joint pain, appropriate evaluation and treatment can be tremendously helpful. The key is distinguishing between testing to address current problems versus testing to look for potential future problems. The conversation about appropriate testing after age 70 should involve honest discussions about life expectancy, treatment preferences, and quality of life goals. If a 76-year-old values maintaining independence and comfort above all else, their testing strategy should be very different from someone the same age who's willing to undergo aggressive treatments to potentially extend life by a few months. Healthcare providers need to be more honest about the limitations and potential harms of routine testing in seniors. Too often, doctors order tests reflexively, following guidelines designed for younger populations, without considering whether they're appropriate for individual senior patients. The phrase, "we should keep an eye on this," often leads to unnecessary monitoring that creates anxiety without providing real benefit. The informed consent process for seniors should include detailed discussions about what happens if test results are abnormal. Many seniors agree to testing without fully understanding that abnormal results often lead to additional procedures, medications, and lifestyle restrictions that may diminish their quality of life. A truly informed decision requires understanding not just the potential benefits, but also the very real risks of the diagnostic cascade. Family members also play a crucial role in this conversation. Adult children often pressure aging parents to undergo extensive testing, believing this demonstrates love and concern. However, supporting a parent's decision to forgo unnecessary testing, when made thoughtfully and with good information, may actually be the most loving approach. Sometimes the greatest gift we can give our aging loved ones is permission to prioritize comfort and quality of life over medical perfectionism. The shift away from routine testing after age 70 requires courage from both patients and healthcare providers. It means accepting some uncertainty and acknowledging that not every potential problem needs to be investigated. This approach isn't about giving up on health. It's about defining health more appropriately for this stage of life. Moving forward, I encourage seniors to have open conversations with their healthcare providers about the necessity of routine tests. Ask specific questions. What will this test change about my treatment? What are the risks if we find something abnormal? What happens if we don't do this test? How will the results affect my daily life? These conversations can help ensure that medical testing serves your goals rather than simply following routine protocols. The evidence is clear that many routine medical tests provide minimal benefit and potential harm for adults over 70. It's time for both the medical community and seniors themselves to acknowledge this reality and adjust healthcare approaches accordingly. Your health at this stage of life is better measured by your ability to engage in meaningful activities and maintain independence than by perfect test results. The goal isn't to live longer at any cost, but to live well for as long as possible. Sometimes this means questioning medical recommendations, even when they come from well-meaning healthcare providers. Your body has already demonstrated remarkable resilience by reaching this age. Trust in that resilience, focus on functional health, and remember that the best medical care sometimes means less medical intervention, not more. The most important test for anyone over 70 isn't found in a laboratory or imaging center. It's the daily test of whether you can wake up, engage with life, and find meaning and joy in your remaining years. That's the test that truly matters, and it's one you can pass, regardless of what any medical screening might show. 7 blood tests. Your doctor orders. But you don't need after 65. Dr. Evelyn Hart explains.